Okay, so there's a 62-year-old man brought to the emergency department after collapsing, unresponsive, no pulse, and after 8 minutes of resuscitation, there's a return of spontaneous circulation, and when he gets to the hospital, he's intubated, placed in mechanical ventilation. Cool beans, all this stuff. Which of the following brain regions is damaged? So the MRI has a loss of gray matter, and his pupils are fixed and dilated with no response bilaterally. So this is going to be cranial nerve 3, the Westphal nucleus. It's going to be in the upper midbrain, and that's the answer. Now let's talk about it. So axonic brain injury, cardiac arrest with a VFib, MRI findings of loss of gray indicates diffuse cerebral edema due to prolonged hypoxemia. So the pupillary, let's talk about those findings, fixed, dilated, no response to light. That means that there's a damage to that light reflex pathway, and that's in the upper midbrain. That's kind of all there is to this question. The afferent limb, optic nerve, cranial nerve 2, light is detected in the retina and transmitted to the optic nerve, cranial nerve 2, and the pretectal nucleus in the midbrain, then the interneuron connection. Pretectal nucleus sends the projections to the Edinger-Westphal nucleus, which is 3. That's the parasympathetic nucleus of 3. And then there's the efferent limb, E. The preganglionic parasympathetic fibers travel through that cranial nerve 3, and synapse of the ciliary ganglion. And then the post-ganglionic fibers travel to the sphinctic pupillae muscle, and then it constricts. So that cranial nerve 3 is damaged. That's what we need to know, because sympathetics are working. They're just not parasympathizing. They're not constricting. And so, yeah, the Edinger-Westphal nucleus is in the midbrain. Okay, so medulla nuclei for 9, 10, gag reflex. That'd be a gag reflex question. Occipital lobe, that'd be like cortical blindness. Parietal lobe, contralateral inferior quadrantinopia would be the parietal lobe visual field defects, like the quadrant defects. Pons, corneal reflex, and horizontal gaze. So that would be like 5 and 7, the corneal reflex. Temporal lobe, visual defects, inferior optic radiations. Meyer's loop passes through the temporal lobe. So that'd be like contralateral superior quadrantinopia, but not pupil response. Pupil response, that's just 3. LGN, that would be the thalamus. That'd be the visual information to the occipital lobe. It doesn't participate in that light reflex loop. So there we go. It's the upper midbrain. If this is helpful, then like and subscribe.